Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Kocharhook, and welcome back for this second segment on the discussion of homelessness situation here in Santa Clara County. With me again are the Executive Director of Destination Home, Ms. Jennifer Loving, if I said that right, and the President of the Santa Clara County Board of Supervisors, the Honorable Mr. Mike Wasserman. Thank you so much for sticking around and going into the second topic here. We discussed a lot last time about defining the problem. And what I think would be really cool for us to do now is to start talking about how to, what are solutions for this problem? Where are we kind of figured out where we are, where are we going, how do we possibly get there, and what do we hope to accomplish over, say, the next 5 years?
I can start that off. I think the first part is acknowledging the problem, identifying exactly the problem. What hasn't happened in the past, Dave, is there hasn't been measurements of how big is our problem, how many individuals, what's it costing us, what services are being used. And as we mentioned in the earlier session, what is now happening is all the individual silos of services that are being utilized are now networked, I guess is the word. I should know that word being in Silicon Valley. Networked together so that we will have actual information. Then we have some programs, which Jennifer is expert on and can explain. We'll be able then to measure those programs to see how effective they are. One thing I like to do is if we put money towards something, I want to be able to measure the results.
This is very much like the corporate America. You know, you have an objective, you have identify where you are now, where you want to go, and you look at possible ways of getting there, and then you try to measure those results to see what works and what doesn't work, and what's working you put more into, and what's not working you take up. But that's not typical government activity. Typical government activity is throw a bureaucracy there and let it roll and keep feeding it. You guys are talking about doing something that is much more deliberately proactive and analytical in the way that you're approaching what is a significant problem. I think one of the things as we go on, I want to talk about, I want you to answer that, but
well, I just want to say
this one other
thanks
thing
for
too.
associating me with not typical government.
Oh, good.
I'll take that as a compliment.
There you go. Well, it's meant that way.
Thank you.
As you're doing this, I think it's going to be important to do what I'm trying to do with this show, is get the average Joe and Jane to understand that this is a scenario that actually definitely impacts them too. And it's not something that you can just turn your back to because it hits your pocketbook. So let's go in and start talking about some of these potential solutions and things.
I mean, I really appreciated what you said about being more purposeful and impactful, because I think that's when I mentioned in the last segment about the charity model, and I think that for a long time that's what we did. We did things to manage homelessness or to make it more bearable for the people that were suffering from homelessness. And
I'm going to add, I think what was done is to make it less visible to
in some cases, and what we decided to do instead, and really only doing that because of the support of our elected officials, both at the County of Santa Clara and City of San Jose, City of Gilroy, Palo Alto, other cities as well, but where we really looked at models that were more effective in other parts of the nation, and something called Housing First. Give someone a house, but not just give with the expectation that you know, all bets are off, people can do whatever they want, but that roof decreases costs over time. And so we decided to look at this model as, how do we turn homelessness on its head, where housing isn't the end game of some long and murky road of years to somehow somebody finds a place to go. Do that first and watch the stability happen. And so Supervisor Wasserman actually led the charge on appropriating enough money for about 100 subsidies to let us do this, like a proof of concept. And that's when we launched the Housing 1000 campaign, which was, can we house 1,000 people? And can we only look at outcomes? How quickly can we house them? How well do they stay housed? Meaning at a year, are they still housed? Do they stop using the system? And are they getting better? And those are the only things that we measure. Well, we measure that through a database called Help Management Information System, which is a database that is mandated through HUD in order to have HUD money, but we were able to create through our partners at Community Technology Alliance a portal, a way to be able to look at what was called a vulnerability index, which looked at things that led to an early mortality.
So how does the data get into that?
people are trained, but service workers, people who work in nonprofits, people who work in the hospitals, the doctors at the hospital systems.
We're not relying on the person to whom the housing is given to try to put. You've got people
that are trained
in responsible locations in the like the hospital, what various and sundry whatever, to be able to kind of keep an eye on how things are going and to report that information into the system, so that now you have valid data against which you can make a judgment.
So we
the
created,
ones providing the service.
Yeah,
Right.
we created a registry that we now have over 4,000 people in it, which comes with names, which comes with pictures of what they look like, so we know how to find them, which has this criteria that looks at the risks for an early mortality combined with how long they've been homeless. And that's how we're able to say, okay, if Mike has been homeless for 20 years and he has diabetes and he is a senior and he has cirrhosis, then Mike is going to die. And before Mike dies, he's going to the emergency room a lot, he's going to go to the hospital a lot, and he's going to, these are all the things that are going to have to happen to him because he's going to have to get help. Or we could put Mike into house, get him what we call primary medical home, and the county has something called Valley Healthcare for the Homeless, which is a clinic that was really self-driven by the medical professionals within the organization that thought that there was a better way to help people than just having them hit the emergency room. And they created not only a homeless clinic, but also what they call backpack medicine, where they actually go and they minister to people in the streets.
Wow.
And so where they are able to help identify people that if not for housing, then folks are not going to survive.
And if I may, I think it's important, she touched on a database of 4,000 people with ailments, with faces, with names, numbers, whatever we can do. That in itself had never been done before.
That's what I was going to ask.
That was a Herculean.
Is this like a huge step forward because this isn't being done in most other places?
Well, it is. It is, because this is all part of this national movement called 100,000 Homes. So at the same time that we were moving towards a housing first model, we learned about 100,000 Homes, which was using this index, this screening tool that was developed through Boston Healthcare for the Homeless. And it was basically the idea of, can communities all agree to use this sort of a screening tool and prioritize people for housing in this way? And there's 230 communities that are doing it like this. They're all doing it in different ways.
Great.
I would say that we have been one of the most aggressive communities in the nation, because we built an army of people using a collective impact model, which really means that there's not, we talked about responsibility, there's not one entity that's responsible for solving this problem. So we have to look at where the jurisdictions or the private sector or who is able to contribute what resource towards the greater good of how quickly can we house people, can they stay housed after a year, do they stop using the system, and do they get better? Those are the only things that we look at.
Jennifer's a very modest woman, okay? You can register, she said 230 communities. There's a lot more communities in this country than 230, first of all. Then you can go out and you can do the job, or you can do the job well. Okay? To do the job well takes a lot more intensity, passion, collaboration, partnerships. I believe what I've seen over the last 3 years, they have done the job well. Your numbers, garbage in, garbage out.
Exactly.
Your information, you can say, well, I'm going to do this and I'm going to measure my results and all the rest, but if you do can't say half-ass on TV.
Haphazard.
Thank you, haphazard, thank you. Job of measuring the results, okay, that's what you've got. Okay, it's very, very important to me. We're putting a lot of money. Some people would think a lot of money. Some people would think not enough money. Okay, but no matter what, we're putting money into a project. We need to make sure what we're doing is working. And as you said earlier, if we find something that's working well, we want to continue to support that. If we find something that's not working as well as we anticipated, tweak it, cut it off, do whatever.
So let's talk for a couple moments here about where people can be housed, because one of the things that's a reality here in Silicon Valley is that finding a place to live, even if you're among the middle class, whatever, people moving here from other parts of the country or get a job, it's not easy to find a place.
No.
Our I don't know what the term is, but the availability of lived in rental is not that high. I mean, so how do you deal with it? You've got you mentioned 2,500, I think was the term, of chronically homeless people. There's an objective to try to find some solutions there. There aren't that many open properties.
No, and our community, using this Housing 1,000 campaign, has housed 770 people over the past 3 years, and every single time that we're able to house someone, it is there's not enough adjectives for how difficult it is, because already there's a lot of competition, already rents are very expensive, already, because when you think of what a subsidy is, when the federal government says this is, we'll pay $1,000 a month towards somebody's rent, well, when the rent is twice that, those subsidies are rendered useless, right? So we've done things to create local subsidy pools here so that we can navigate our own housing crisis. But the single most important problem and solution to homelessness is a house. And the inability for us to have resources to be able to create more housing. We've used the traditional public routes of housing authorities and redevelopment before it went away, tax credits. But what we could do if we wanted to was invest private capital using public land, create the type of micro housing units that we need, and we could end homelessness in our community. It is really just about the cost that it would take to build these units and then to provide the services that are necessary to keep people housed.
What kind of cost are you talking about?
I think it would cost $500 million in private money or more to be able to jumpstart an effort that would get us 3,000 to 4,000 units of housing. And we sell apps or businesses or photo sharing things that we have on our phone for twice that, 3 times that.
Right.
So it's not like the money doesn't exist. It's that we haven't decided that this was the way that we want to spend our value. Like, what is the ROI in this?
Well, and let me ask a question about that. Then let's take that as an estimate number. Let's say it's going to cost $500 million in order to create, build, put the physical structures together where you can house the number of people you're talking about. What's the opportunity for the private investor within that? Because investment dollars are very black and white. If I put money in, I expect to get a reasonable return on that investment. And so how can we couch this, or maybe not couch it, how can we present this in terms of an investment opportunity that actually makes sense for the people who would put the money up for that?
Do we want people living and sleeping in all of our meridians as we get on the freeways? Do we want people living and sleeping in all of our parks? Do we want people on our hiking trails and our biking trails and our places where our children play? Do we want people living outside? And do we want to step over people as we go out to dinner? I mean, when we think about homelessness, it isn't just about a person who doesn't have a home. It's about what our community is saying about that, that we would rather step over people or look past people or somehow tolerate that there are the largest homeless encampments in America here in our backyard. And so this isn't just about helping the homeless person or the people themselves. This is about the kind of community that we want to have. And when we know that there's a solution that, while has a cost, in the long run is not as expensive as doing nothing over the long run, we have to ask ourselves what's keeping us from doing that.
Is this something that could be funded via government? $500 million to the government is like nothing.
Okay, and
and
for your viewers, you're saying $500 million.
Yeah, that's what I said. $500 million, not million, billion. So $500,000. But when you look at it from a
$500 million.
million, sorry,
yes.
$500 million, and that's what you were saying,
and that's
right?
a ballpark number.
But if you look at federal, state, county,
Nice ballpark.
local kinds of activity, is there a opportunity for at least some of that to be able to? I mean, we're paying our taxes and all that sort of stuff, and if we recognize that it's an issue, and we as citizens say, yeah, this is something that we should put some attention on, then it would be reasonable to expect that as a community it is addressed, and that the funding associated with that would come from the community contribution. So I'm not expecting an answer to that question. I'm posing the question.
The local government has put in tens of millions of dollars into this in money in ways that they have never done before locally over the last few years. I don't think it's again, collective impact. It's not just, tech's responsibility. It's just not the county's responsibility. It's just not the housing authority's responsibility. That's where we come to, is there land? Is there the ability to construct the types of units and the density that we need? Is there the ability to provide the services that are necessary? Is there the opportunity for upfront capital to jumpstart some of these projects? And so it isn't just, again, one entity is responsible, but what we are trying to say is that there is an answer.
There is an answer. Good.
And I have some information for you. For instance, the cold weather shelters that we have in North and South County. The county spends a couple of $1 million a year on those. We, in the first year that Jennifer and I combined forces, if you will, we were able to get $1 million out of the budget for some temporary housing. Now, this last budget round, on a unanimous vote from the Board of Supervisors, we have allocated out of the general fund $4 million a year for each of the next 10 years.
Wow.
Okay, so that's money towards that. But $4 million a year is a far cry from 500 million.
Right.
And the 500 million number she's saying is not to solve the country's problem.
No, that's just
to
solve our
Santa Clara County's.
You mentioned something that I want to go to. Jennifer, you mentioned something about the largest homeless encampment in did you say America?
I think definitely one of the largest homeless encampments.
And there was an article in Wednesday, September 24th's issue of San Jose Mercury News that talked about that, I guess that location. They call it, the headline says dismantling the jungle. And so I guess this is a location here in the city of San Jose that has a large number of people living there in a tents and whatever. It's a homeless law. How many people are there? What can you tell me about this? And I think we actually have some slides, some shots that were part of the San Jose Mercury News article that the guys are going to be showing as we talk about this. But what can you tell me about this?
Well, this is a camp that has grown over the last few years. That is in San Jose near the Happy Hollow Zoo and Park. And
near Happy Hollow?
Right across the street.
Wow.
From Happy Hollow Zoo and Park, you can hear the roller coaster from the encampment. It has grown to maybe 250 to 300 people that are living there. It is absolutely horrifying conditions. But the difference, there's something really important that's happening there where there's close to 300 homeless encampments in San Jose. People don't think about that. And so
that's hard to believe.
And so what has historically happened for decades is that, rightly so, neighbors would complain, people would complain. It would hit the radar of, there's an encampment of 20 or 30 people staying here. We have to get rid of them, right? So the bulldozers would come, and other water district or parks or whoever, and that encampment would be moved along. They would have to go somewhere else. We're not solving the problem. And so what is happening right now with the city of San Jose and in partnership with the county of Santa Clara and others is that there's been a real dedicated effort to not just close down this camp and have everyone scatter once again, but to try to use rapid rehousing, housing first, the same type of what we're talking about today, to help the people that are living there instead of just shoving them out into the next place that they will go. And that is a new a new way of doing business that has not been the reaction historically, and all of the jurisdictions, from the water district to the city to the county, should be applauded for taking this approach, because choosing to solve the problem instead of just
as
move
opposed
it
to just
around,
kicking it down,
which can't tell you how many encampments have just been moved around.
Oh yeah,
over
clearly, that would seem to be the thing that happened. That goes back to that comment that we talked about earlier about not in my neighborhood. As long as it's not, as long as I can't see it, it's not a problem.
Yeah.
Okay.
And you don't blame people. Nobody wants to have an encampment in their backyard. Nobody wants to have a thing that is you walk out your door and you see 20 tents there. But I think what people fail to understand is the folks that are living there don't want that either.
Let's talk about that. Go ahead.
And we also have, you mentioned 300, I believe, 300 encampments, somewhere around as far as a round number. You take that times 20, 25, that gets you to your 7,000 people, is what happens over our 1,300 square mile Santa Clara County and 15 cities. So you have all that going. People don't want to see that. The people in there don't want to be there. She talked about the area in the Mercury that you referenced, the jungle. That's a name that came from somewhere.
Right.
There's a lot of vegetation, there's water, there's all of that, and there's a couple of hundred people that live there. But the horrific health situation that exists there and safety,
I would think, yeah.
it's none of your viewers would feel safe there during the night, much less during the day. They wouldn't want to be there. It's a tough situation, but despite that, we have people from the county and I'm sure other organizations that you're aware of that go down there to provide registration, medical services, attention, trying to attack the problem. Jennifer also brought up housing first. That ties back into a comment that you made and that you made about most important thing is putting a roof over someone's head. Okay, and there's issues about temporary housing, permanent housing, transitional housing.
Right.
Get in there, get yourself cleaned up, get a job, be on your own. All of that's happening throughout Santa Clara County. It's a very much a collaborative effort, but it's a big problem.
It's not a one-size-fits-all. It isn't just about giving everyone who's homeless free housing forever, right? People who can get a job and rebuild their lives, they need to do that, and they need to.
Right.
But they might need some temporary short-term rental assistance.
Right.
But there's a whole lot of people that are sick and aging and mentally or physically disabled where the reality is no one can have 5 minimum wage jobs, but let alone someone in that position.
Right.
And it is cheaper then to subsidize their rent than to have them do these multiple high-cost visits throughout
Right.
our system. And that's when you get down to the economics. That's my tax dollars, that's your tax dollars.
Right.
These are things that even if you don't want to care about the problem, we should care about a good stewardship of our money.
Right. So one of the things I'm going to suggest to you, this article from San Jose Mercury News was a revelation, I'm sure, to a lot of people. I saw that. I had some inkling of the situation in the county because we've had some conversations before the show, to set up the fact that you were coming here. But I didn't even know that this existed, the place they call the jungle. So my guess is that this was something that was an eye-opener to a lot of people. The challenge with that eye-opening is that out of sight, out of mind type of a situation. So what I want to talk about in the last 5 minutes that we have here is for us to look at how do we maintain momentum? How do you help keep the reality awareness there for the average people so that they can continue to support the initiatives that people like yourselves have been putting in place?
Sure, I'll touch on a few things. Media coverage is excellent. Politically, at the city level, at the county level, newsletters, there's faith-based organizations, there's service clubs, there's CBOs, community-based organizations. CBOs, we have so many acronyms in our business, I sometimes mix them up. But you've got the public sector, which I was just talking about. You also have the private sector. There's a number of individuals on Destination Homes Board from the private sector that are concerned about this. They're making their employees aware of the situation, and people are trying to help in a variety of ways. But it takes a village,
Right.
going back to that expression. Okay, it takes a village to solve this, and it's a village's problem. Every man and woman in that camp or any of the others is somebody's son or daughter.
Right.
Every single one of them. For whatever reason, they are out on their own. Maybe it's a drug or an alcohol or a mental addiction back from the war. Maybe it's hard luck, lost their job, health purposes. Whatever the reason is, those are all human beings. And every one of them, like I said, is somebody's son or daughter, maybe brother or sister. And I think through help such as your show here and other means, the Mercury's article there, that raised your awareness. This show that you're providing, and thank you for the opportunity on behalf of us, is providing your viewers with more information. And maybe they will reach out to various websites and say, I want to help out financially, time, whatever it takes.
We're way past the point where 5 or 10 units of housing or small fixes is going to fix the crisis of homelessness that we have. If we want to get out of the problem that we have to have a concerted collective effort to create thousands of units of housing to be able to resolve the needs of our lowest income, most vulnerable residents. And the thing is that it's not impossible to do that.
Right.
This is not an easy thing to do.
Sure.
It's an expensive thing to do, but in the long run, it's the right thing to do.
But that's not to say, I'm going to add to that, that if someone that is watching this show says, look, I have a fourplex down in such and such, I would be willing to, that you'd say, oh, no, it's not big enough, you know.
No, we
every
will subsidize
every
that.
little
We will
piece
subsidize
helps
that rent, and
achieve,
we will
achieve the objective. And yes, we
Yes.
do need to take
sure.
some major steps in the direction of creating the multiple housing kind of solution that you talked about. Maybe it's micro homes, it doesn't matter. You don't need, I mean, these folks are living in tents that are like what? 10 square feet. So now you get a 300 square foot place that you can live in. I mean, that's a palace.
Yeah. They say
Relative.
you can eat an elephant one bite at a time.
That's right.
So with our efforts, that's going on here, we also need all the other counties, Santa Cruz, San Benito, Alameda, all the other counties around us to do the same type of program.
Right.
Because what we've been talking about here during your show is what's going on in Santa Clara County.
Right.
Believe me, it's happening in Santa Cruz County,
Sure.
Alameda County, San Benito County. It's everywhere.
Right.
22% of the entire homeless problem in America is in California.
Yeah, in California.
Every county has trouble.
Yeah.
And so it would, and the thing that is really cool about this is there's actually an answer.
Yeah, and I think that's really great. So, and I appreciate the fact that you guys have joined me here to talk about this, because it is a significant thing. It's an awareness thing, folks. I hope you have been paying close attention, because this is a problem that we now know has a solution, and it's a problem that impacts each one of us individually. We're out of time, so I want to thank you both for joining me here on Reference Point. Folks, don't forget, if you have any questions for either Supervisor Wasserman or for Jennifer, send a query into info@referencepointtv.com. We'll make sure it gets to the right party, and then you'll get that question answered. And volunteer time, funds, facilities, whatever, to help us solve this problem.
Thank you.
Supervisor?
Thank you.
Jennifer, thank you so much. And ladies and gentlemen, we'll see you next time on Reference Point.